The best thing about the UCLA COMET program is that we are fully integrated, not only with ourselves for individual patient care, but throughout the health system. So we serve as sort of one-stop shopping for patients and referring physicians of all specialties who have patients who need treatment but may not be able to get it because of their size. The operations that we do are 100% laparoscopic, meaning that we do small incisions and patient recovery is greatly enhanced by that. Dr. Chen and I operate typically 4 or 5 cases a day, and we operate 2, 3, sometimes 4 or 5 days a week. We have a comprehensive clinical pathway before operation, at the time of operation, and post-operatively for the patient's lifetime. If a patient comes in to see us because they are suffering with obesity and its metabolic consequences, we start them immediately on a regimented program that includes preoperative workup, which is completely thorough. We get the patient to demonstrate some lifestyle changes for us related to food choices and exercise. And finally, we make sure that they're medically stable to undergo surgery. For patients who are larger and suitable candidates for surgery based on the NIH's criteria, offers sleeve gastrectomy and Roux-en-Y gastric bypass performed laparoscopically. Those operations are overnight stays in the hospital. The patient goes home. Within a couple of weeks, they're back to their old selves, and their weight loss is very rapid, especially for the first 6 months after the surgery. We've had no issues with leaks after the operation, which is one of the things that we get concerned with doing bariatric surgery. And the safety profile is better than any published safety profile in the literature. The safety profile in general for bariatric surgery is much higher than commonly types of performed surgery, such as gallbladder removal and hip replacement, to the tune of about 10 times safer than hip replacement or 7 times safer than gallbladder surgery. In the COMET program at UCLA, we offer both surgical and non-surgical approaches. We work very closely with the Center for Human Nutrition. So we have bariatricians who are medical doctors who help manage obesity, and they provide various types of dietary and lifestyle changes and recommendations and programs, along with medical weight loss drugs. It's not just surgeons, though. We have 2 nurse practitioners, we have 2 dietitians, we have 2 bariatricians, we have a hepatologist. And by having us all in the same place 1 day a week for the entire day, patients are able to get comprehensive care, and we can tick off the boxes of things that need to be done for patients before they go to surgery and to make sure they're successful afterwards. The secret to success in COMET, I think, is our focus on patient education, because if the patient is on board and understands what to do, they have a much better chance of fulfilling all the requirements of our clinical pathways. The more they know, the better they'll do. UCLA's COMET program did about 300 bariatric surgical cases last year, and we're on track to do more than that in the coming years. When I see these patients, especially the younger ones, the ones in their 20s and 30s and early 40s, we've probably given them another 10 to 15 years of extra life. And the quality of the life is going to be much higher than it would have been struggling with obesity and dieting and gaining weight and dieting and gaining weight the whole time. You go from somebody who can't walk up a flight of stairs to somebody who's running a marathon, and that's satisfying.